Good evening. It is April 1st, 2024. So thank you all for joining in. We missed our show last week, so we'll have most likely two shows tonight, one at 8 o'clock and one at 8:30. For those that are able to join us, please do so. So I wanted to start out, as we customarily do, with reviewing what we call a winning strategy. So we'll have a chance to do that this evening as well. And I wanted to go over with you the winning strategy that we call the war orientation. And as we all know, that we generally use war as generally carries somewhat of a negative connotation with it, but we are trying to positize something that generally has a challenging thought to it, to really talking about us having an orientation to be willing, to be able, and to be ready. And willing to see myself and others as capable and responsible. Able, what I don't know, I will learn and I will share with others. And being ready, that I believe I and others deserve the best. And that as we begin our days and also take some time to reflect on what we've accomplished in a circumstance, we should keep in mind and ask ourselves to evaluate whether we were willing, able, and ready. And what's important to recognize is that it's a trifecta. So sometimes we may find ourselves in a situation where we are willing, but sometimes our abilities are something we have to work on. They're not something that's there naturally. And then sometimes we have our willingness and our ability is there, but often we're just not ready. And what really works is when we're able to bring all of those three things together. And then again, that's having that war orientation, that we're going into it, understanding that we are willing, able, and ready. And what's often important to understand is that we don't generally give ourselves credit for all that we've accomplished, because I don't think we often realize how much work it took. And using this one view is to just recognize that what happened because we brought all three things together. We brought our willingness and our ability and also our readiness to the circumstance, but also when you begin to look at things that went wrong. I hope that this also gives you a view, a screen to apply to try to understand what was challenging. Was it that the willingness was missing, the ability was missing, or the readiness was missing, or a combination of all three? So please keep that in mind. That often we are fighting something that is very strong, and we often want a lot. And we need to understand and be able to dissect what is it that we're looking to accomplish and what is it going to take to pull it off. So again, hopefully this is something that you will find as a useful resource as you consider what worked and what's challenging. And often we don't realize that often as we look at things, the problem is the solution and the solution is the problem. So that we recognize that often as we're trying to tackle something, we need to make sure that we bring all three of these ingredients. But often as we're trying to figure out what went wrong, those same ingredients will tell us what the problem is. And so we often want to believe that things are so complicated and there's so much beyond what we can comprehend and understand. Hopefully this is a reminder that, again, often the solution is the problem is the solution. All right, so hopefully you can add that to your arsenal of things that you call upon to help you figure out where you want to go next. So we have a guest this evening, and we had an opportunity a couple of weeks ago to have her sister join, and they're twins. I think Michaela's probably going to tell you she's the better looking of the two, but I think they look exactly the same. But well, I'm sure Michaela's going to try to tell you something different. But without further ado, I'll add Michaela to the screen. So how are you tonight, Michaela?
I'm good. How are you?
Very good. So, I forgot. Are you guys identical twins or fraternal? You are identical.
We're identical. Yep.
Okay.
She's a
Uh,
little bit taller than me, but that's it.
really? Wow.
Yep.
So, why don't you tell us a little bit about Michaela and the way in which you'd like us to get to know you? I know that you have a profession that you're in that is also identical in
Yep.
lots of ways to your sister, but rather than me describing who you are, why don't you do so?
Sure. So I grew up in a small town. I am a twin. Obviously, Dr. Nat already said that. I have a younger brother. The small town I grew up with, I was 15 minutes away from my grandparents, so I became very close to them. So I'm a very family-oriented person. I love educating people, helping out people in any way I can. I love animals, going to the movies, and taking up new hobbies. Right now, I'm into crocheting. So
Really?
that's my
Wow.
new one.
Wow. What have you crocheted?
Right now, I'm working on a blanket.
Oh,
Before in high school, I crocheted little shawls for cancer patients.
okay. Wow. And what is there something that you really want to get the skills and ability to crochet? Besides the blanket, is there anything that you're looking really to create?
I hopefully will want to do my own like sweaters and like
Okay.
cardigans and stuff like that, but that's down the road. We're starting off small with the blanket.
Wow. Where did you get the idea to do crocheting?
My gram taught me a little
Mm,
bit.
wow. Well, good for you. Good for you.
Thank you.
So you mentioned about the small town, and so did your sister when she was here. How much of an impact did that geography and that environment have on you as a person, especially growing up?
Yeah, I mean, I think it definitely made me appreciate things a little bit more than the big city living. It took
Mhm.
time for me to like really get to know people, see how they lived in their certain ways. I felt like, I was always very comfortable going to someone in my neighborhood if I had a problem or needed help with anything. So I feel like growing up, that really impacted me to become the person who I am today and wanting to give back those same qualities to my community.
Mhm. So I assume that you must have transferred out of the smaller town to towns that are a little bit bigger. Have
Mhm.
you seen that difference though, where you in a town that you grew up with, you probably knew everybody, and now you're going to some places where knowing everybody is a little bit more challenging. What are your thoughts about that transition? And do you think there's a benefit to having both experiences, one more valuable than the other, or what are your thoughts about
I
the
think it
size?
definitely is a challenge.
Mm,
I went to school in Philadelphia,
mm,
and most of my clinicals were in Philadelphia as well. So going out into the community, I saw that people were a little bit more guarded with wanting to tell me what was going on in their life,
mm,
which was definitely understandable. I feel like talking to them though and gaining their trust allowed me to be able to help them in ways that maybe other providers
mm.
would not have been able to if they did not grow up in that smaller community and see how they can earn their trust.
Wow. And you mentioned something, especially in the work that you do in is medicine. And when people don't tell you everything, what is the challenge that you face as a medical professional trying to deal with what I call the 2%? And the work that I do of personal development, often people only tell you about 2% of the story,
Mhm.
but they want 100% of the problem solved, which makes it pretty hard
Right.
to expect that I can just magically fill in the 98%. But I assume in your work, it's
Mhm.
so much more critical because it may mean the difference between life and death and between comfort and
Mhm.
discomfort. So what is your feelings and thoughts about revealing information, especially in a medical situation or health situation?
Right. It's definitely challenging. I think that, in the beginning appointments, you really have to start off small by gaining their trust. Telling them you want to offer help, that, the questions you're asking may be difficult, but you can't give them your full help if they can't give you, everything that they have. I feel like it's a lot of digging on your own, seeing where they've been in the past. A lot of like social work too, trying to see where they live, what do they have in their neighborhood to help them out, what are their surroundings like. So I think getting all that information together and then coming to them with a solution to maybe part of the problem at least is helpful.
Wow. And when you look at some of those social work factors, why is that important in the work that you're doing as a medical professional?
It definitely takes into a fact, I think it's really important that medicine is not just about the pharmacological aspect.
Mhm.
Medicine is really nutrition, it's about safety, it's about your diet, it's about how you're growing up and interacting with people around you as well. So I can help any way I want to with the medicine part of it. But if I don't know how to help with the social part, with their diet, or do they have a place to sleep at night? Like what is the safety factors? I feel like I'm not giving my 100% as a provider. So it's
Mhm.
really important for me to know everything that's going on in their life so I could be able to help them as well.
So in your work and in your studies, uh, what have you learned that's important for a person to be thinking about as they choose an environment? Because as you were talking, that I don't think people would think that the grocery store and how well it's stocked or
Mhm.
not stocked. So an example, about 10 or 12 years ago, I was doing a show on a Lehigh Valley channel, and so we had taken a trip to Camden, New Jersey. And at that particular point, and I pray it's been improved since then, but at that
Right.
particular point, there was no supermarket in the city of Camden. That if they wanted
Oh.
to go to a supermarket, which the closest one of scale was Walmart in Cherry Hill, that they would have to travel there. But everything in the
Mhm.
city was pretty much corner stores.
Mhm.
And so when you think about the freshness of the products that may be available in a corner store versus a supermarket, but that may be an environmental factor to keep in
Right.
mind. Again, whether there's playgrounds, but what are some of those other things that you listen for as your patients are talking to you, just to cue into as some of the limitations that or the pluses that their environment that they're
Mhm.
coming from may or may not have.
Yeah, so usually when I'm talking to my patients, there's a couple things I usually ask them. If they're younger patients, I usually ask, are they in their community? So they see a lot of like alcohol, drug abuse. How do they feel being in that environment? Do they feel safe? Do they have resources that they can reach out and help that to reach out to someone if they need to ask them the questions? Um, Sometimes with my older populations, I ask them more about like food. Who do they have in their house if they need help? A lot of these communities, even though they may not have grocery stores, like you're saying, they have programs set up for the elderly, like Meals on Wheels, that you can help them get enrolled in. I Back in my small town, we had something called the Fresh Food Pharmacy that if you were a patient who was diabetic or were suffering from congestive heart failure, you can get enrolled in this program and they could deliver fresh food for your house for a week. So I
Wow.
try to get engaged in my community and look for these resources to try to help them as much as possible as well.
And one of the things as you were talking that came to mind is, I guess, a major barrier to people getting the information, getting the resources, um, is pride and
Mhm.
not letting that get into the way of, especially as you're dealing with your health. Do you find that that's a variable that people have to try to? Again, I can see a child not saying to you that there's food insecurity in their home because they don't
Mhm.
want to slight or disrespect or make their mom or dad, whoever their provider is, to look bad.
Mhm.
I can just see that pride may be something that you have to try to mitigate in the work that you do, to let them know that, as you started out, that they can trust you, and you're not here to
Mhm.
judge them. You're here to judge the resources that they're gonna need. What are your thoughts about that?
There's definitely an element of pride, and I think that as you meet with that patient, visit to visit, I think that element kind of goes down as they gain your trust. I
Mhm.
think always being there to show up for them, knowing that, they could trust you, you're not going to back down, you want to help them, you believe that in them that they want to get better, they want the food resources, they want to stop smoking, they don't want to do the alcohol, they don't want to do the drugs. I think that element of you believing in them is also really important as well.
Mhm. Wow. And so you're, if I'm correct, you're a certified and registered nurse practitioner. Is that what you are? Or did I
A
mess that up?
physician assistant.
physician assistant. I'm sorry.
Yeah,
Uh,
no, you're good.
Thanks. um, how did you choose to? Your sister talked about she chose the physician assistant just because the load was to be a little bit more family friendly in the long
Mhm.
run. Why did you choose the physician assistant route as opposed to a nurse,
Mhm.
a doctor, or any other the allied fields in medicine?
Right. So I was definitely in between a lot of fields in college. I started off wanting to go to vet school. I loved animals. So that was up until like junior year. And then between junior year and senior year, I was deciding between vet school and PA school. As I started looking more into PA school, I noticed that there was a lot more flexibility between the fields. So I could start off in cardiology for 2 years and then say I wanted to do something else like pediatrics. I could switch to that. With going to med school, I would have to choose one field and stay with that throughout my whole career.
Wow.
Like Alexis mentioned, you would also have like there is a lot more flexibility. I do want a family at some point, and knowing that I wanted to choose a career that would allow me to do so.
Wow. Wow. And so, what has been a really happy moment as you've studied and gone out to the work field? And what has been a challenging moment for you professionally, if you don't mind sharing?
Nope, a happy moment. Definitely, I'm gaining my confidence as a provider. I just started working a few months ago.
Mm,
But actually today I had a patient, and she was elderly. She was 90 years old, and her son was in the room with me while we were discussing her chronic illness. And I spent a while in the room, maybe 30 to 40 minutes, going over everything with them. And at the end of that, the son said to me, you were really one of the only providers who sat down with us and told us what was going on. And I really appreciate that for you. So I could see that, I was owning what I was doing. I was believing that I could help them and showing that I wanted to help them.
mm,
Challenging moments for me definitely still are happening on a daily basis, just trying to learn everything in the system. Medicine changes on a daily basis. So you have to really keep up with the guidelines and figure out what is changing, what is not changing, what can you do to improve your quality of care for patients.
mm. Let me ask you a question. In the work that you do, unlike a lot of other fields, people's lives are very dependent on your skills and ability. How do you settle your spirit, understanding that you could be the thing? I have a pastor, um, and he had to be revived 10 times, and I think he's pretty close to 80. And I was like thinking, what if he, after the eighth time, they just gave up trying?
Yeah.
But, they kept working on him. And a couple of weeks ago, the pastor invited the medical doctor to church and gave him a plaque and said thank you. And but one of the other things I remembered him sharing was that he was on the board of directors of that hospital. So you just wonder. So I send out letters to all local hospitals. If you need any board members, I'm willing to sign up. You don't have.
Yeah.
Um, but what? How do you deal with that aspect of the work that you do, where people's lives are very contingent? And again, I know you're surrounded by other
Mhm.
people. You're on your own, but you're not alone. There are other
Mhm.
people that are part of the practice. But in lots of circumstances, your skills and ability are what people are relying on in that moment. And how do you settle with that awesome responsibility that you have?
It's definitely stressful. I feel like I do stress myself out a lot, getting anxious about it. I do turn to prayer a lot.
My questioning just now is not
Yeah.
it's not helping. I'm sorry.
No, you're good. I do turn to prayer a lot to try to ask God
Mm,
to help me guide me through my day. Give advice to the patients and try to put them on the best medicine path that they can.
mhm,
I think always listening to what patients want, especially if they're in a chronic state, asking those questions ahead of time, like what do you want for your final moments? Do you want to be on full life support, or do you want to go peacefully? Knowing that, before anything major happens, really helps to calm me, so I know what my path will be for that patient if
mhm.
it comes to that.
Wow. And so you mentioned about medicine. What are your thoughts about the use of medicine. There are some medical professionals that believe that we use too much medicines. Some others believe just enough. Still, some other believe not enough. There are some people that, when they are in a situation where they're challenged by illness, will not take anything that is often, perceived to be medicine. What are your thoughts about the role of medicine in people's lives and in our society?
I definitely think that medicine plays an important role in lives, especially if you are challenged with social factors, like I mentioned before, that you may not live in an area which provides fresh food. You're probably more likely to have heart disease or diabetes.
Mm,
Without those medications, your life would not be comfortable. I do think though, if we started at a very early age, knowing what diet and exercise and not smoking, not doing drugs, not doing alcohol could do for you in the long run, I think that the use of medicine would decline
mm.
very quickly if the population, was educated a little bit better on what they should be doing at an early age.
Yeah, you bring up a really good point about a diet, and I think a lot of times, especially for children, some of the things that we think is okay for them to be consuming at such a young age, and often the titles of what they're called, such as I'll get in, McDonald's doesn't sponsor me, so I can say it, but is sometimes I think the Happy Meal is not so much a Happy Meal. So talk a little bit
Mhm.
about the implications of diet in so many years. You're talking 20, 30, 40, 50, 60, 70 years of this
Mhm.
consumption. What has been your knowledge and awareness along the lines of diet?
Yeah. I think that as, medicine is starting to see that diet is really playing an important role starting at a kid's age. We're really seeing an increase in childhood obesity. So it's really important that we start educating not only parents, but also children, what they should be eating. Because at a certain point, when a child is 8, 9, 10, they can start making some choices of their own. They don't have to choose the Happy Meal. They can choose a salad or they can choose rice and chicken. So I think putting those education points in those kids at a young age could carry through with them. When they get to 60 or 70, and then they may not need the medication, like I mentioned before, um, at
Yeah.
that age or at that point of time.
And I think you bring up, as you were talking earlier about the societal factors, I think those are so critically important. There was a
Mhm.
young man that I worked with years ago, and his first day with us in a group home that I was running, he ordered a salad. And I just thought that was the weirdest thing because none of our children ever ordered salads. But he then went
Mhm.
on to be arrested for murder. And
Mhm.
so I think that, yeah, it's good that they understand the diet and how to make some good, healthy choices there. But they also need to be able to deal with, how they're going to make money and how they're going to hopefully do it
Mhm.
legally. And it's that whole person that
Mhm.
we're trying to do a better job of raising people from a very early age to just take care of themselves in totality. Because again, to have an affinity towards salad and going to jail, I don't think they're doing a lot of salads there. Um,
No, probably not.
so I think it's really important for us to just keep in mind that they have to be fed and mentored in so many different ways. And again,
Mhm.
often, as you said, if we did a better job earlier on in life, there may be some of the issues. I mean, I passed a sign uh, that said that whatever the hospital group was, there were 20,000 employees in that hospital system, and that's one of the
Mhm.
two largest in this area. And I was like 20,000 employees. That's a lot of people. And if the
Mhm.
other, large unit has another 20 or 30,000, that's a lot of people that are, working
Mhm.
to try to keep people healthy. And again, you begin to wonder if some of the other choices that we could make would make that less of a need in lots of different ways. As
Mhm.
we get ready to wrap up our time, Michaela, I know that you just started your physician assistant track. I know you mentioned that you'd hopefully one day looking to start a family, but what else is on the horizon for you as you look toward the future?
I definitely want to do a little bit more travel. I was in school for the last 6 years, so I
Wow.
didn't really get a lot of traveling time. So hopefully some bigger trips planned in the future for me.
Where have you gone so far, if you don't mind sharing?
Just in the US, I've not traveled out of the country, so just
Don't feel
states. So
don't feel
yeah.
bad. Maybe about 10 or 15 years ago, I was asked to do an international tour overseas to speak to the troops, and I never served in the military, so it was really a good experience to do that. But that
Mhm.
was my first time out of the United States, and it was,
Yeah.
and I had a chance to, I think we traveled for about 21 days and visited maybe, 8 or 9 different countries, and it really was a really good experience. And I keep
Mhm.
that I want to go back again. But then COVID happened, and so the trip we had planned
Yeah.
didn't happen. But I hear you. But just understand, I'm 59, so please do a lot better job to start international travel well before you're 59.
I will try.
Please do. But Michaela, it's really been a wonderful, wonderful opportunity to have a chance to talk to you, and I thank you and your sister for, joining us over the last couple of weeks to talk about the work that you're doing and to educate us. And I really want to wish you the very best in your future, and I hope that in the future you'll have a chance to come back. I know Neats is really excited
Yeah.
to have met you and to help you figure out your living situation. And so
Mhm.
I'm really glad for you, and it seems like it's well deserved. And those 6 years were worth it. So enjoy.
Yeah. Thank
All
you
right,
so much. Thank you for having me.
my pleasure. Thank you. So, ladies and gentlemen, we really had a really good chance to talk with Michaela about the work that she's doing in the medical field and her work as a physician's assistant and all that she's experiencing in that line of work. So I hope that that's been enlightening for you, and that you keep in mind that we are often in the life that we're leading, fighting a war. We have to be strong. And as Michaela, I think, demonstrates, she's willing, she's able, and she's ready. And we should definitely follow in her footsteps. So without further ado, we'll wrap up for tonight. We're back next Monday at 8 o'clock. There is an 8:30 show tonight, so hopefully you're able to join us for that. But if not, be well till next week. Take care.